So UHC Day is Universal Health Coverage Day, and that happens every year, December 12th. And that's the day that the United Nations and all the global health community have designated to focus attention on progress towards achieving the goal of health for all. It's important because the goal of achieving health for all is not new. It's been around for a long time. But the UHC Day right now makes people come together to rally around that concept and to also create some forward movement and coordinated action towards making that happen. And many times when you talk about health for all, it's one of those goals that everyone likes, no one can fight against, but it's also nebulous and so difficult for people to achieve. What ends up happening is that the people who are marginalized, people who live on the edges of society, the poor, tend not to get these services. And so in having this day gives us an opportunity to call attention towards those who have been left behind. If you look at countries by their income status, high-income countries are closer to the goal, while the low-income countries and the lower middle-income countries still have some ways to go. If you think about countries by geographical locations, countries in Africa and Southeast Asia and some parts of Latin America still have a lot of work to do, while countries in Europe and in the US have made significant progress. It's not all rose petals for high-income countries, because even in the US, for example, 5% of children do not have access to health insurance. And if you count the number of people who are underinsured, which means people who have insurance but still end up paying a lot for healthcare, that number goes way up. So it's not all beautiful stories for high-income countries. There's still a lot of work to do, especially for people who are living in poverty in those countries.